Some scientists in the United States have unveiled results of a small clinical trial. This clinical trial, upon completion, could mean an effective cure for sickle cell anemia. Sekinat Adeyinka reports.
There just might be an end to the worries of having to deal with the trauma of sickle cell.
There's so many ways to describe it. I mean, I heard people say it feels like chainsaws or in your bloodstream. That's similar. But for me, it feels like my body is starving for oxygen. And it's suffocating. You know what I mean? I feel like I feel myself dying.
The painful disease inflicts millions of people across the globe. Researchers at the National Institutes of Health say they use the gene therapy techniques to add a corrected gene for healthy red blood cells. These they put into the bodies of 9 test patients, replacing their diseased red blood cells caused by sickle cell anemia and effectively ridding them of signs of the disease.
The gene therapy that has now been applied to a small number of patients as part of a clinical trial seems to have worked spectacularly. These patients who had sickle cell disease, now when you look at their blood counts and their blood smears, it looks like they don't have it anymore. Now, it's early days. We've only followed these patients for a year at the most, but it looks like it would be fair to say this could be a cure.
Sickle cell disease is an inherited blood disorder that causes protein crystals to form inside red blood cells, changing their shape from a flat disc into a crescent or sickle shape that then clogs up into small blood vessels and results in terrible episodes of pain and organ damage.
Normal hemoglobin's somewhere between 12 and 15, and people are said to be anemic if they're lower than that. Patients with sickle cell disease, at least the adult patients with sickle cell disease, have hemoglobins of 7, and to have their hemoglobin go up to normal, and then to look inside the red cell and see what kind of hemoglobin it is and find it be derived from the vector that we put in their cells was just extraordinary.
Within 2 or 3 months, the 9 patients showed signs of remission and were starting to discover normal health for the first time in their lives. Lindrick Holmes says he started to feel better about a month after his bone marrow transplant.
So to be free and I can break that expectation, like I'm not the same Lindrick, So I'm gonna be like, yep, that happened. I was a part of that, and I don't have sickle cell anymore.
The researchers believe that about 7,000 other diseases could benefit from the single gene addition therapy. But according to the director, Francis Collins, it requires many more years of hard work. Sekinat Adeyinka, TVC News.